I am on a mission, and my mission is to change the way that menopause is perceived and treated. So when women used to tell me, I don't recognize myself anymore, this is not who I am, I can't handle the stresses I used to, I truly understand now, okay? And the good news is there's something you can do about it. It's not just about hot flashes, it's not just about night sweats or sleep disruption or heart palpitations or even a little bit of anxiety that everybody understands, I think that they do, that these are the common symptoms of menopause, okay? But we're gonna talk about all the conditions that can be exacerbated by the loss of your sex hormones or caused by that, okay? So things like heartburn or constipation or fatigue, okay? Or changes in cholesterol level, those are the kinds of conditions I'm talking about. All the way down to the degenerative diseases of aging, right? So you don't go healthy disease, right? You go healthy symptoms, syndromes, diseases. So it's a continuum again. Everything's a continuum. We want to talk about the benefits of estradiol. Now, I will let you know that there are 400 positive benefits of estradiol that we know of. And that's because all hormones affect every cell in the human body, right? Through their binding to their receptors, okay? So I only put a few up in here. Estrogen has positive effects on your brain. It has positive effects on your eyesight. It has positive effects on your hair, skin, and nails, and bones, and muscles, okay? It has positive effects on your cardiovascular system, on your immune system, on your GI system, on your GU system, which is the genital urinary system. So there isn't a system that estradiol doesn't have a positive effect. Okay, which means as we go through all of these side effects and syndromes and conditions, you're going to go, really? That could be caused by estrogen or the loss of it? When you're stressed, and remember, stresses are emotional, they're chemical, they're nutritional, okay, they're physiologic, which be how you're exercising, and they're hormonal. So there's different kinds of stresses. I'm not just talking about emotional. But whenever adrenaline levels rise, okay, you actually have a ceiling, okay, of how fast and how much adrenaline you can put out for a certain stress, and that's modulated a lot by estrogen in women, okay? So when you lose estrogen, or estradiol, you get this big rush of adrenaline, okay? That's where you're feeling the jolt. All right, the anti-inflammatory effect of estradiol. It's anti-inflammatory. We know this for a fact. C-reactive protein, has anybody ever heard of that chemical? Okay, we measure C-reactive protein as a measure of inflammation in the body. It's in its relationship to coronary artery disease, okay? C-reactive protein goes up in menopause when estradiol goes down, and you give estradiol, C-reactive protein comes back down again, okay? So we know that estradiol is an anti-inflammatory hormone. A lot of women manifest this as joint pain, okay, especially in the hips for some reason, okay? Hips, knees, wrists, you'll get a lot of joint pain when estradiol levels go down, okay? Again, good news, you get on estradiol and that inflammation goes away. Boost the immune system. Very typical to have increased risk of sinus infections, okay, as women are going through menopause. Improves insulin sensitivity. Estradiol is a hormone that helps insulin help you rebuild yourself, right? Okay, so insulin sensitive means, and that's a good thing, when you're insulin sensitive, it means your body's responding to your insulin levels, okay? You're insulin resistant when it doesn't respond anymore. It's a neurotransmitter, right? It's what helps you remember all those nouns and why you went into that room, okay? So it's a very beneficial brain hormone. It's a calcium channel blocker. When calcium gets into your cells, you constrict things, okay? So without estradiol, if calcium's getting into your muscle cells too much, you can have a lot of cramping. It's a vasodilator, so it keeps blood pressure from going too high. So again, one of the things that happens to women as they go into menopause is their blood pressure gets higher, right? Okay. It's involved in healthy bone formation, right? So bones have to turn over all the time, right? That's what keeps them healthy. You have to break them down and build them back up again, and break them down and build them back up again. And estradiol kind of modulates the breaking down side so you don't break down too quickly. Because if I break down too quickly, I won't be able to rebuild my bones. All right, so women who go into menopause in those first few years have a lot of rapid bone loss, okay, because of the loss of estradiol, and then it kind of plateaus out. And then increases melatonin levels. That's what makes you sleep so well, okay, the melatonin level. So we absolutely know that as women age and estradiol goes down, melatonin goes down with estradiol. And when you give estradiol back, melatonin comes back up again. Okay, so, and again, I'm touching the surface of what this hormone can do for you.